So my project started when I looked at the anonymous graduation survey that's given to all Canadian and American medical students, and saw that over half of them report experiencing mistreatment or abuse throughout the course of their medical career. So this could include harassment, violence, discrimination or prejudice on the basis of sex, race, sexual orientation, any other features. And it could also include embarrassment or humiliation. So a variety of different experiences reported on this survey, but really, really high numbers. When I started to talk to my physician colleagues about these results, it's sort of shocking to me as an academic that half or over half of medical students are experiencing this type of mistreatment or abuse. So when I started to talk about it with my physician colleagues, I got a lot of reactions like, well, show me the other 40%, or I'm surprised that it's not closer to 90 or 100%. Like, it just seemed to be this expectation of this is something that you're going to experience in your medical training, and there's some bad apples there, and most of us are, good, kind people, but you're going to run into some bad apples, and this is just the way it was. It was worse when I was a trainee, they would always say. But it was really interesting to me that it was sort of accepted that this was something that happens in some places, and not really sure what to do about it. At the same time, I'm also interested in the idea of professionalism, so positive professional behaviors is something that we're really interested in medical education these days, and how we're going to evaluate competency in acting professionally. And thinking about these two experiences on different sides of the spectrum, of on one side we're so unprofessional behaviors from some people that learners are getting mistreated or abused, and on the other side trying to formulate these clear ideas about what professionalism standards would look like in different contexts. And it seems that these ideas aren't dichotomously opposed, but there is some area in the middle, some gray area about the context that the behaviors are experienced in, nonverbal aspects which give color or meaning to somebody's verbal remarks, the relationship of the people involved, where it would be hard to say, is this unprofessional? Is this just sort of an unproductive, erosive type of behavior in the workplace? Or is this really mistreatment or abuse? Like, where does some of this stuff fall out? And in medical education and medicine, we, I think, have a lot to learn from our colleagues in organizational behavior, who've spent a lot of time studying how groups work in the workplace and operate, and how we can do that more effectively and more efficiently. And so I'm working with Catherine Connolly, who's an associate professor in the School of Business and a real expert in organizational behavior and how groups share and hide knowledge and work with information and ideas to study how this takes place in the clinical learning environment, paying specific attention to how people understand the difference between productive, erosive, uncivil behaviors and mistreatment or abuse.